And we are back with more What's Now, taking our attention to health and wellness, especially lung cancer. I recently spoke with two individuals who have had lung cancer and very different experiences and journeys, and they have some great insight. Let's take a look.
You've been diagnosed with lung cancer. So, what now? What do you need to ask? Where can you go? And how can you find the newest treatment options? Unfortunately, lung cancer is a leading cause of death among Black Americans. And here to talk more about this is Dr. Sydney Barnes and Brandi Bryant, both lung cancer survivors. Thank you both for being here today.
Thank you for having us.
Thank you.
Dr. Barnes, let's start with you. You are a lung cancer patient and a doctor. Tell us about your story.
I noticed when I started residency that my exercise tolerance was diminishing. I was becoming more short of breath. I am normally a very active person. I dance, swim, ran track, and I realized that I was just getting more and more short of breath, and then I started wheezing. Now, I do have a very strong family history of asthma, so I thought that was what was going on, but I decided to go to a pulmonologist to get checked out. And after a whirlwind of tests, actually got diagnosed with stage 4 lung cancer, which was completely shocking to me because I have no risk factors for lung cancer. Thankfully, they sent my tumor off for biomarkers, and I was found to have a biomarker, so started on targeted therapy, and I was able to complete my residency working 80-hour weeks and continue working and living a very normal life. And now I'm no evidence of disease 5 years after the fact, which is amazing.
That is amazing. Brandi, you're also a lung cancer patient and you're doing very well on targeted therapy because you found out about your biomarker. Tell us about that.
So my story is similar to Dr. Barnett's. I was 39 years old, very busy mom of 4. I had a tiny cough for months that I didn't think anything of. It was really quite minor. But and I was active. I like to take long walks, walking like 25 miles a week. But after the walks, I noticed shortness of breath when I was just having conversations. So that prompted me to go to the doctor. After a series of tests, I was diagnosed with stage 3B lung cancer. I was initially diagnosed at a local community hospital, but I was very fortunate that they did send my tumor off for biomarker testing. I had no idea what that meant. And I still had to, because I was stage 3 when I was initially diagnosed, I had to do chemo and radiation. However, when I progressed a few months or just 2 months later, I had the choice of doing immunotherapy or targeted therapy. But because I knew what my biomarker was, ALK positive, I knew to choose targeted therapy because immunotherapy doesn't work well for ALK and a lot of biomarker driven cancers. But it's definitely made things much better for me. I had my youngest kid was 3. I couldn't climb the stairs. I couldn't do anything. And once I started taking the targeted therapy, I felt markedly better within just a couple of weeks. Like the fluid was draining from my heart. Everything was feeling better. And I've been no evidence of disease since 2018.
Dr. Barnett, tell us exactly what a biomarker is and why patients need to ask their doctors about them.
So each cancer is unique, and some cancers have mutations that are driving the cancer to progress. And that is what the biomarker is. A biomarker is a mutation that is driving this cancer. There are many different biomarkers such as EGFR, KRAS, ROS1. Brandi and I are both ALK positive, so our mutation is ALK. And what a targeted therapy is, it literally zooms in on that mutation and turns the mutation off. It's so much better tolerated than chemotherapy and radiation therapy. It actually works much better for these mutations than the chemotherapy. And because of that, a lot of patients are able to lead pretty normal lives with it, which I think is one of the reasons why research is just so important. had we been diagnosed 10, 15 years ago, we wouldn't be here. And now we need to know what further therapies are out there and what reasons people are getting cancer so that we can potentially save more lives.
Brandi, would it have made a difference in your treatment and in your quality of life if you had known your biomarker earlier?
I was fortunate to know my biomarker earlier. I just did not qualify for the treatment at the stage. At that time, I didn't qualify for the treatment at the stage that I was initially diagnosed, but it definitely made a difference whenever I progressed to stage 4. Knowing that I had that biomarker gave me a treatment that actually saved my life, because immunotherapy does not work. It actually it has the opposite effect on ALK positive and some other biomarker driven cancers. So without that, I wouldn't be here today. So biomarker testing was extremely important, and is if you're newly diagnosed.
And Dr. Barnett, how can people be screened for lung cancer, and who should be screened?
So right now, the screening criteria is geared towards smokers. If they smoke 1 pack of cigarettes a day for more than 20 years, if they are between the ages of 50 and 80, if they stopped smoking, less than 15 years ago, they do qualify for a low-dose CT for screening for lung cancer. However, I do implore anyone who has a persistent cough that won't go away, anyone who's wheezing without any history of asthma, anyone who has been treated for pneumonia more than once and the symptoms is not going away, I would implore them to speak to their doctor about getting screened for lung cancer, because these are some of the symptoms that a lot of lung cancer patients who have no known risk factors are presenting with. And the earlier that we find the lung cancer, the better it is.
Brandi, when you learned about lung cancer, were you surprised about how little federal funding is earmarked for lung cancer?
I was very shocked to learn about that as I got into lung cancer advocacy, because for me, the drug that I started taking, the targeted therapy, just came on the market 2 months prior. And that's due to research. And if we don't have the research funding, then we can't get these drugs to help people with this #1 cancer killer. I want to be here for many, many years with my children and my family. You want to be with the ones that you love. We want to be here, and we want to help newly diagnosed people have hope. And you have hope when you see people like us, right? So the more research funding we can get, the more that we can get these therapies and treatments that'll help us be here longer.
And Dr. Barnett, tell us more about why someone who has lung cancer would join a clinical trial and how people can participate.
So one of the things I want patients to know is clinical trials are safe, and clinical trials are the way that we learn the therapies of tomorrow today. It tells us how we can learn more about the cancer, what is driving the cancer, and research is what gave us where we are right now. And if the traditional therapies are not working anymore, if chemotherapy, radiation, immunotherapy, targeted therapy are no longer working, then it is so much better for you to go into a clinical trial to find out what can prevent your progression, further progression from happening. Now, if my cancer was to come back and was not responsive to things that were on the market, I would definitely go into a clinical trial. And that is one of the things that I want people to know. Clinical trials are definitely the way moving forward if you are not able to do any other therapy.
And Brandi, any other advice for our viewers, and where can we find more information?
So yes, the advice I'd like to give is if you're newly diagnosed, please ask your doctor what is your biomarker. And if you want more information, you can visit lcfamerica.org, where there is information on the different types of biomarkers, treatments, clinical trials, and more research, which is critical. So lcfamerica.org.
Well, thank you so much, Brandi Bryant and Dr. Sydney Barnett, for joining us today. Really appreciate your time and how thoughtful you've presented this information and shared your story.
Thank you.
Thank you.